Hey there, welcome back to our channel where medicine meets clarity. Today we're diving into one of the most underrated yet critical diagnostic tools in hematology and rheumatology. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Free light chains, what they are, why they matter, and how to interpret them like a pro. Antibodies are made of two heavy chains and two light chains. Those light chains can either be kappa or lambda. Normally, our plasma cells produce a little extra light chain. These unbound fragments, called free light chains, circulate in the bloodstream. These free light chains are usually cleared by the kidneys, but in plasma cell disorders, this balance breaks, resulting in elevated levels or skewed ratios. Here's where it gets interesting. Free light chains are a powerful diagnostic marker in several conditions, some of which may be missed with standard tests like SPEP or IFE. In AL amyloidosis, for example, misfolded light chains often lambda deposit in tissues, causing multi-organ dysfunction. And in light chain myeloma, you may not see a classic M spike at all. The serum free light chain assay uses nephelometry or turbidimetry to measure kappa and lambda chains individually and calculates their ratio. Kappa normal range is 3.3 to 19.4 milligrams per liter. Lambda is 5.7 to 26.3. The kappa to lambda ratio should be between 0.26 and 1.65. This range can widen in renal impairment. If the ratio is significantly skewed, greater than 1.65 or less than 0.26, that points to a monoclonal process. But if both are elevated and the ratio is normal, it could just be polyclonal activation or renal dysfunction. Let's break down what the FLC pattern could mean in practice. High kappa, low lambda, and a ratio above 1.65 suggests a kappa-restricted clone. High lambda, low kappa, with a ratio below 0.26 points to a lambda-restricted clone. If both are elevated but the ratio is normal, think polyclonal rise from infection, inflammation, or renal issues. Normal levels and ratio likely mean no monoclonal process detected. Remember, interpretation always requires context. In kidney disease, both kappa and lambda can rise, but the ratio stays within a widened reference range. So when should you order this test? Anytime you suspect non-secretory multiple myeloma, amyloidosis, unexplained neuropathy with systemic features, follow-up, or elevated ESR with unclear cause. In smoldering myeloma, an FLC ratio above 100 or below 0.01 is a high-risk feature. And for AL amyloidosis, it's one of the most sensitive early markers available. Caveats: FLC assays can be falsely abnormal in infections, autoimmune diseases, and renal failure. They don't subclassify immunoglobulins, so always pair them with SPEP, UPEP, and immunofixation. Use serial FLCs to monitor treatment response. A normalized ratio suggests deeper remission. Persistent abnormalities may mean residual disease or relapse. Free light chains are more than a lab test. They're a window into clonal plasma cell activity. They help us catch disease earlier, stratify risk, and monitor therapy more effectively. If this helped clarify FLCs for you, give it a thumbs up and subscribe for more breakdowns like this. Got a topic you want us to tackle next? Drop it in the comments below.